So I've just had a remarkable week working with lots of friends in different organizations here in Perth. And I've been astonished by how much is going on here, how much collaboration, how many innovations are going on. I had a chance not only to work with Dr. Davies in the homeless healthcare and his doctors and nurse practitioners in the clinics, including the clinic at Beacon House, but also to go out on the streets with the homeless healthcare team that's working with RUA to take care of people directly in the streets. And I also had a chance to go to after hours care with them to go to see some folks who had recently been housed with the 50 Homes, 50 Lives, and got to watch these remarkable clinicians and social workers and service people go and take care of homeless people in what I think is an extraordinary way. I also had a chance to go and do inpatient rounds with Dr. Amanda Stafford at Royal Perth and Dr. Davies, and got to see that these folks, when they're in the hospital, now have really caring doctors and nurses and social workers who look out for them and help to plan good discharge things. So what I found in Perth has been really extraordinary, and you have the foundation, I think, for everything that I think we dream of having. I would say that what's missing, and most of the folks I talked to sort of highlighted that, is a medical recovery center where people could go between the hospital and being back on the streets or in the shelters. And I think it would be a remarkable addition to what you already have here. I also wanted to add that we've learned in Boston, and I think it will become something very valuable here, is that as we try very hard to end homelessness for each individual that gets into housing, that the supportive services that you need in housing are pretty complex and flexible. And a medical recovery center becomes a really important part of that supportive housing service, something we hadn't anticipated in Boston, but we found when folks were living alone in an apartment and they're sick or not doing well, they really can't care for themselves. So to bring them back to a recovery center is really invaluable, and in many cases has been able to preserve their tenancy.